Welcome, everybody. My name is Marlon Solomon. I am the president and founder of the Afrimerican Culture Initiative. We are a nonprofit, Boston-based, here in the beautiful Hyde Park, Massachusetts, which is a part of Boston. Our mission is to build cultural bridges in the African diaspora through education, technology, and travel. We want to welcome everybody to our inaugural pilot of our COVID-19 contact tracing awareness program. This program is something that we decided to do in response to the devastating second wave of COVID-19 that is currently plaguing the country, with the lack of leadership, at least on a federal level, with misinformation, with, I guess, starving of the population, whether it's businesses, even the governments, and even the individuals. Everybody's hurting economically because of this pandemic, and it's only getting worse. And in response, we believe that the only way to ensure that we are, that we can help the situation is by educating people and spreading a message of hope in these tough times. Now, this is not our primary work. Our primary work, of course, is with African diaspora cultural education. So, of course, we're putting together an online school, which should be launching early next year. And we cover a lot of different topics, but mostly to do with African diaspora education, which is African immigrants, African Americans, Afro-Latino, Afro-Caribbean, those cultures in particular. And then, of course, people of non-African descent that are within our communities of color. And we decided that using our cultural competency would be a great way to get the message out about COVID-19 to multicultural communities using our cultural competency approach. So that's what this is about. I want to thank everybody that has signed up, attended, donated, shared. We appreciate you all. And so let's get right into it. So, like I said, I want to welcome everybody to the Contact Tracing Awareness Program. Please fill out the polls and surveys. This is very important so we can get your feedback on how things are going with this program, especially this beginning program, so that we can do our best to improve our work. We have a question and answer session. Please put your questions in there. Please raise your hands if you need to speak, and feel free to comment in the chat. Like I said, we are a cultural education consultancy, web hosting services, webinar hosting services. So if you want to do a webinar like this, let us know. Go to Eventbrite and you see all of our events there. Okay, so this webinar's objectives are actually quite simple. Right now, we're looking at 251,029 deaths. That's over 250,000 deaths in the United States due to COVID-19. In the last week, we've had, I think, 1,707 is the highest since May. The highest death total in all is about 1,820 something deaths. So what this means is that we are approaching a point of exponential growth in COVID-19 all across the United States. So we decided that we would put some information into the community to help with the spread. And that is done through contact tracing. In communities of color, we need to do it with culturally competent, preemptive, culturally competent methods. And we want to stress the importance of these contact tracing to the community of color, but more in a cultural way, because obviously there's a lot of misinformation going on out there. And if we don't reach the communities of color and break through some of these cultural barriers, some of this misinformation could catch hold. To overcome, so we want to overcome some of the cultural, governmental, and language communication barriers. So we're, this program will be translated. We're going to make some videos. We're going to do some more and more webinars and really try to drum up a lot of awareness. We understand that there may be technical issues with people getting, not having access to connections and computers to attend webinars. So we're focusing on established webinar channels, like through schools, so that we can overcome the hump, right? But it's important that we let people know that there are things that we can do in addition, especially with knowing our contacts, that are going to save lives. Another thing we want to do in this lecture is to really highlight a different tone, and I will be using this different tone throughout the webinar. And the webinar is like, this is not fun. Okay, there's no more fun. We are at war with COVID-19, and we need to act like it. We need to be vigilant. It is not a matter of political correctness. This is extremely important, and we need to act like it. We're in mid-November, but at the end of October, during trick-or-treating, I was very, very disappointed to kind of get this mixed message that we can trick-or-treat with social distancing. There's a pandemic killing people, thousands of people every day, but we can still have fun. We cannot have fun anymore. Not at least until the next 2 or 3 weeks. There's vaccines coming, but they're not here yet. And until they're here, we have to hunker down. Right? So, in this cultural message that we're trying to send with COVID-19, I asked one of my friends, she's Jamaican American, to share her experience. She had a scare. And I'll let you watch the video, and then we can talk on the other side.
Hi, everybody. I am here to talk to you today about my experience with the coronavirus test. Sometime last week, I started feeling sick, like scratchy throat and just really fatigued. And then I had a cough, but it started to get really bad. And, after 2 days of feeling like this, I started to panic. I said, oh my God, I hope I don't have COVID-19. So I thought about who I was around, and if anybody was infected, but then how do you know? Because people they don't have any symptoms. They're asymptomatic. So you just don't know who's infected, who's not infected. So I made a couple phone calls to the friends that I was in contact with, and I said, I'm sick. Are you guys sick? Do you have any symptoms? They said no. If you get a test, let us know. My doctor's office. I used our health portal. It's called My Health Online. And when I went on there to make an appointment, I saw that there was a COVID test. So I took the test, and I had many of the symptoms, but not all. And I still felt a little worried, and I was thinking I should probably tell my family that I live with so that they don't then go out and infect somebody. So I told my family that I wasn't feeling well and that I think I should get a COVID test. And, they felt that it was best that I quarantine in the basement away from the rest of the family, which it feels bad no matter what. It's the right thing to do, but it just. She took my hands and told me to grip the side of the bed. I was like, oh my God. And then she just shoved this thing up my nose as far as it could possibly go. It's very uncomfortable. It hurt for like 2 seconds. It actually wasn't painful. It's just your reaction is to like just get it out. There's something in your nose. You want to get it out. You want to shake. You want to move. But it literally is like 10 seconds long, and it's fine. I was scared, to be honest. I wondered if it did test positive, how would that affect my friends that I was around? Is everyone I know now going to die because of me? I felt guilty. There were a lot of emotions, At some point, I thought, well, if I do have this, maybe I should write notes and say goodbye to everyone because, you just don't know. As soon as the doctor saw me, she said, I don't think you have COVID. Based on all the questions and everything, but I'm still going to give you a test. She said, nobody leaves urgent care or the emergency room without a COVID test. I said,
We're all very grateful that my friend Shireen, that she tested negative for COVID-19, and she's doing very well, and she has not had any COVID even now. Now, whilst we're going to talk a lot about, the technical bits, there's a lot more going on in our communities of color, especially with African diaspora community, that people are not really understanding, especially when it comes to like the fact that many of the nurses are African immigrants, African Caribbean, and they have to deal with a lot of things firsthand. Now, the new normal, one thing that they always complain about is that the new normal is not, for some people, that they're not really making any big differences in their lives. They are still going out, they're still hanging out, thinking that everybody around them is safe. So much of this program, this awareness program, has to do with just even fighting the COVID-19 misinformation. We all understand it's been about 10 months since the beginning of March that we've been either on lockdown or some sort of lockdown, socially distancing. And it's called COVID-19 fatigue. That is what people are calling it. And I understand it. Who wants to, not be around your loved ones, especially around the holiday seasons as we're getting close to. But it's just something that we must do. Like I said earlier, we are at war and we must act vigilant. There's a super lethal second wave right now that's going on. We just passed 250,000. Listen to that word, million. 250,000 people in the United States of America have died. Not they are sick, they have died. The cases are now 11.5 million, going on 11.6 million cases. And they're projecting that in the next 2 to 3 weeks, it's going to be like over 2,000 people dying every day. This last week, we had a case of one day, I think it was Tuesday, we had 1,707 cases in one day. I mean, no, sorry, deaths in one day. If I'm trying to make you scared, then yes, I am trying to make you scared. Fear is just a motivation factor, but it's not that there's no hope, but we need to be vigilant about what's going on. It is not a relaxing time. There are going to be, in the next 2 or 3 months, there are going to be another 200,000 or so, like 100 and something thousand, 200,000 people that are going to die, and it can all be avoided. One thing I try to tell people in my little personal conversations about COVID-19 is that imagine it is not really, okay, it is not really about even the cases or the deaths. Pardon me. As much as that sounds weird, it is really about the hospitalizations. And once the hospitalization in your local area is filled up, in effect, you do not have any more hospitals. What am I saying? If you're, I had a family member that had just like, a normal procedure. Yes, but you have to go in, maybe you spend a day or two in the hospital and you're out, right? The husband was driving around looking for a hospital to put his wife in. And by the time he got the person in, he just stayed in the parking lot. He couldn't even go in. So you're now going around looking for the hospital. So in effect, when these hospitalizations get too much, you literally have no hospitals in your area. And that means that if you have any other illness, you're just on your own. There, this year, there's been 30% less cancer diagnoses because of COVID-19. Is it that people are getting 30% less cancer? No, that's not true. What it is that people are refusing to go to the hospital. Me, I'm supposed to go to the dentist for like the last 2-3 months. I have not gone. I just said, well, I'd rather have some holes in my teeth than to be in a casket. So that's why I haven't gone. And so, of course, we want to encourage everybody to do any kind of virtual health measures, because we don't want the health system to be overloaded. So we want to even, I'm going to say a lot of things multiple times during this conversation because we have another section of this, but go get your flu shot. Okay, go get your flu shot. That's one way you won't be in the hospital because of flu. Don't tell me I never get flu. Today can be your first time. And if it's your first time, you don't want to go there and be surrounded, and you could even get COVID in the hospital. So please make sure that you're doing all you can to stay healthy. Then there's the economic turmoil. Moratoriums to keep people out of eviction. Those ones are going out of system. There's very little unemployment, very little jobs. There's a lot of issues. The politicization of public health. Wearing a mask is not a public health. It's not a political statement. The disease does not care if you're Republican or Democrat. It's coming after you all the same. All right. The disinformation campaigns, which this video it's very touching video. We're going to play in a little bit, but the disinformation campaigns that COVID is not real is equally devastating because it means, of course, people are not acting like that. And I saw a stat of all the 15 worst states in America that are suffering from COVID-19 as we speak today. 2 of them are Democrats, Democratic states, but even then they're in the Midwest, Illinois and Wisconsin. The remaining are all Republican states, and it's all because of a lot of them have been told that COVID-19 is a hoax. It's not real. And then, of course, there's the social and mental stress. Some of the social stresses have even shown itself in Black Lives Matter in this country, even in End SARS in Nigeria. There have been a lot of, social stress because now we're sitting at home and we get to question and ask questions because, things are not going right. Then there's the mental stress of even dealing with everything. Kids are at home. There's a lot of good things going on in this new normal that is already difficult. So fighting the misinformation, we have to do it here because it's going to hopefully save lives. So let us watch this video. And the video is about a nurse in South Dakota. This story is less than a week old. And she talks about how the misinformation and in some cases disinformation are affecting people that are suffering from COVID.
You said that even now that the hospital is being overrun with COVID patients. They come in, they're horribly ill, they're gasping for breath, and yet they don't believe they have COVID?
Yeah, I think the hardest thing to watch is that people are still looking for something else and they want a magic answer and they don't want to believe that COVID is real. And the reason I tweeted what I did is it wasn't one particular patient. It's just a culmination of so many people. And their last dying words are, this can't be happening. It's not real. And when they should be spending time FaceTiming their families, they're filled with anger and hatred. And it just made me really sad the other night. And I just can't believe that those are going to be their last thoughts and words.
Anger and hatred towards you?
I think it's just a belief that it's not real. And nursing happens to be on the receiving end of that. And that's okay. We can take that. That's what you're there for. It's just in the bigger picture when you try to reason with people of, can I call your family, your kids, your wife, your friend, your brother? And they say no, because I'm going to be fine. And you're watching their oxygen levels, maxed out on what we call vapotherm at 100%, and their oxygen level might be 75. That's not really that compatible with life. And we know where that's going to head. And it just makes you sad and mad and frustrated. And then you know that you're just going to come back and do it all over again. And that's kind of where that stemmed from.
How could it not make your own head explode? They're gasping for breath. Their oxygen levels are dropping. What do they think is wrong with them?
I think people look for anything. People want it to be influenza. They want it to be pneumonia. They want it to be, we've even had people say, well, I think maybe it might be lung cancer. Something so far-fetched. And the reality is, since day one, when COVID started in this area in March, you've kind of been able to say, if it walks like a duck and talks like a duck, it's a duck. Like, I hate to tell you that you have COVID, but that's what you have. Even after positive results come back, some people just don't believe it. Now, that's not everybody. We have a lot of patients who are very, very grateful for their care and very thankful for what you do. But unfortunately, that's not what I'm remembering right now. And as my nursing career, that's not what I want to be remembering for. I want to remember the saves and the happy situations. And what I was remembering chilling on the couch the other night with my dog was not that.
Of course not. Of course not. And it's just so mind-blowing to think that they would rather have lung cancer. They'd rather a diagnosis of lung cancer than of coronavirus. And so, you've said that it just, if I quote you from morning television, it's an effing horror movie that you live every day. And so what toll is this taking on you?
Yeah, hindsight, I didn't realize that this was going to go viral. I probably could have left the F-bomb out of there, but the reality is that's how you feel. And so it is like it's just a movie where the credits never roll. You just do it all over again. And it's hard and sad because every hospital, every nurse, every doctor in this state is seeing the same things. These people get sick in the same way. You treat them in the same way. They die in the same way, and then you do it over again. And we're so thankful for the lessons we've learned along the way, and we're doing a good job of taking care of the people that come in. And we're managing our patient loads here right now. Sometimes it's day to day, sometimes it's hour to hour. But the reality is that right now it's not getting better. You said just as you started the show, 50 to 60% positivity rate. Our entire state has 880,000 people. It doesn't take much to do the math on that for how many of us are sick.
Oh my gosh. When you hear your governor, Kristi Noem, say, my people are happy. They're happy because they're free. What's your response?
I think it's frustrating as a healthcare provider because the last thing that we ask anyone when they seek care is how they voted or if they're a Democrat or Republican. The last thing we ever think about is that. what we think about is, how can I help you? And so anybody that uses any chance to make this political makes any healthcare provider want to scream, because at the end of the day, we just want to help. And if we don't get some help from the public as far as mask wearing and social distancing, there's a thing on the internet right now that says, I'm not your first line of defense, I'm your last. And that actually is true in South Dakota, that by the time you get to me and the team that we work with, it might be too late for some. And that is heartbreaking, because the reality is we're a small state. The town I live in has 650 people, and we have 680 deaths right now. I mean, that's my entire town wiped off the map. We know these people, we go to school with them, church, grocery store. It's every small town story you've ever heard.
But just so I understand, Nurse Doring, you have more deaths than you have people in your town.
Yeah, in the state of South Dakota, I haven't looked in the last few hours. I think we had 683. Don't quote me on that. But the town I live in has 650 people. So when you put in perspective, and people listen to me talk about this for the last 9 months, that's every single person in our town gone. That's pretty mind-blowing. If we had a tornado that came through and killed 20 people, we would stop and look, and the national news would be there. And so the fact that we have this many deaths in a town or in a state this size is mind-blowing to me. And it's not currently getting that.
So let that be a lesson. One of the striking things she says to me, and as an African person, it really touches me when I hear things like she wanted them to call their family. And you know how important family is to African people, African descended people. You want them to reach out to their family and call the family. These are your last moments, so you better call your family. And they're there spewing hatred and anger because they realize they're dying. When you're dying, your body won't be telling you you're dying, and you're dying, and you realize that you were wrong, that it was not a hoax, that it was true. It's got to be a very sad way to go. And anyway, we thank her for her sacrifices and all the things
said that
she's
even
doing
now,
to all the things that she's doing to help our communities. Anyway, God help them. So, like I said, so now we're doing contact, this is about COVID-19 and contact tracing. So really, whilst we're going to talk a little bit about the disease itself, we're more concerned with stopping the spread, okay? COVID-19, of course, is an infectious disease that causes severe acute respiratory syndrome. Basically, it fills your lungs up with mucus and stuff, and blood clots forms blood clots in your system to the point where your body can't get enough oxygen and you just die off. It causes multi-organ failure as well. It's just a nasty disease. Now, one of the main characteristics that makes COVID-19 exceptionally difficult to control is the fact that it has asymptomatic spread, which means that you do not have any symptoms. However, you are actively spreading the disease. From the time you get infectious, by the time you get exposed to when you start seeing symptoms, is what they call the incubation period. It lasts from anywhere from 2 to 14 days. And for most people, it's by the time 50% of people start showing their symptoms within 5 days, right? Now, when you start showing symptoms, if you're lucky enough to start showing symptoms, that is, and I say lucky because the symptoms at least give us an indication that the contact tracing should start, right? Contact tracing cannot start if you're asymptomatic, because you will be spreading the disease and you won't know, which is why we have our mantra of wear a mask, wash your hands, socially distance, and we add contact trace. So those 4 things, because wearing a mask is because we don't know who is having the disease. I don't know if I have the disease, so I need to cover my mouth and stop spreading droplets. right? But if you should be lucky enough, like I say lucky because at least we know, I think it's better to know than not to know, in my opinion. It's tough, but hey, it is what it is. If we should find out, then we need to start, the main purpose of contact tracing is to reduce the exposure to people within the that have the infectious period, during their infectious period. So you just, once you're infectious, we don't want you to be exposed to anybody. And that's what contact tracing is all about. We want to know what, and okay, and then the rule is, once you start showing symptoms, 2 to 3 days before that, that's when your infectious period started. So what that means is that before you start showing symptoms, you will be infectious. And it normally leaves 2 to 3 days beforehand. So it's important that we now know who we were in contact with those 2 to 3 days. And that is the concept that we're going to be learning here today. Okay. Another thing that we need to know about COVID-19 is that, in the beginning, it was all about droplets and touching things, not touching your hands, washing your hands and things like that. Those are all very important. But since then, we've learned about airborne COVID-19 spread, as well as dosage. And what airborne means that if you're in a room, especially in a closed area room, so you want to stay away from all closed area rooms, particles stay in the air and they can last in the air for hours, 2 hours, it can be there, depending on the kind of viral load that is being expelled by an infected person. Then is the concept of viral load and dosage. What does this mean? This means that there's a certain level that you can get to before you get sick. You can be exposed to COVID-19 and you didn't get enough to get super sick, right? Or you could get a lot of exposure to a little bit amount of COVID, but you've been in there for a long period in time, and then that could get you really sick. So it is not just like I get exposed to it once and then I get a certain amount of illness. Anyway, let's watch this quick video and we'll carry on from there.
Transmission of SARS-CoV-2 occurs via droplet transmission, contact transmission, and aerosol transmission. Droplet transmission occurs when respiratory droplets produced when an infected person coughs or sneezes are inhaled by a person nearby. Contact transmission occurs when a person touches a contaminated surface and then their mouth, nose, or eyes. Aerosol transmission occurs when respiratory droplets containing the virus mix into the air and are then inhaled. COVID-19 is stable for up to 24 hours on cardboard, 2 to 3 days on plastic and stainless steel, and up to 3 hours in aerosols, which include fog, mist, dust, air pollutants, and smoke. Therefore, it is possible to get infected by touching contaminated objects or through the air. The incubation period is the time between infection and symptom onset for an illness. Estimates for COVID-19's incubation period vary from 2 to 14 days, but it is generally assumed to be around 5 days. There is more debate about the latent period, which is the time between infection and infectiousness. It is now thought that people can be infectious before showing symptoms, and so the latent period is shorter than the incubation period.
So that is just a little brief of information about some of the ways it can get spread, how it can stay on objects, how it stays in the air, how long the COVID-19 stays in the air. So it's very important to not be in areas that are enclosed. I say this all the time. So this is a neat little graph that I saw, and it really goes to talk about the viral load. So what this means, viral load, like I said, if I'm in a room that has lots of COVID-19, but I'm in there for 1 second, I may not get that sick. And this graph shows here, right? This is when you get exposed, this red dot. And as it goes up, right? This is the viral load you need to get infectious. So this is where people maybe are getting, this first part before you get infectious, might be where you are exposed to COVID-19. But if you're not exposed to a lot of COVID-19, or maybe the virus doesn't have chance to duplicate within you for some odd reason, you may never reach this level of infectiousness, and you may never reach this level of symptoms, but doesn't mean you're not carrying the disease. Once you get above a certain level of viral load, then you become infectious. And this is, like I said, this is the key area. If you notice, there's a gap between when you become infectious and when symptoms show, this little green squiggly line. That is the normal 2 to 3 days before your symptoms that now we need to know. This is the area of contact tracing that we need you to be very aware of. We need you to know, who were you contacting, who were you talking to while your virus load was going up, but you were no longer infectious. You were not showing symptoms, right? And in this period is when we need you to quarantine yourself or isolate yourself, sorry. Okay? That is a difference. Isolation is when you are sick, you're infected, and you are staying away from the rest of the healthy people, right? Quarantining is when people who are healthy are told to stay in place, okay? Now, we're going to go through a little video here, of course, of the, this is not political. I know we have Donald Trump up here, but there is scientific evidence that says that our current president is the #1 source of COVID-19 misinformation in the United States. So we must address what he does. And there was a super spreader event, which will go and show what can happen. And I want you to imagine your own community or your own family members. But please remember the modes of transmission when it comes to droplets, contact, aerosol, being indoor. We talked about the viral load, the opportunity to transmit. That means how many contacts have you been in contact, and also the intensity of the contact. How close were you to the person, as well as how long were you around that person. Let's quickly watch. It's a very short video, but it really goes to show.
President Trump announced that he tested positive for coronavirus on October 2nd. The president formally introduced his Supreme Court nominee, Amy Coney Barrett, just days earlier during a September 26th Rose Garden ceremony. Several of the attending audience members have since also tested positive for the virus. Here are some key moments and interactions from the event.
Decide the survival of our Second Amendment.
Some other people also got infected after this. So it's not like Vice President Pence got, this is kind of early, this is October 2nd.
Public safety and so much more.
They've had 3 outbreaks in the White House. Taking hands, getting close, spreading the virus.
So I've been telling Jack.
They were outside. But you can see no masks. Oh, Chris Christie, he was hospitalized very seriously. And her son also got Barron, also got infected. So you can see, it looks as innocent as ever. It doesn't, COVID-19 doesn't go around saying, hey, I'm here, I'm going to infect you. It just looked like a normal situation, right? No big deal. And so many people from that event apparently got sick from the disease. They've had so many hospitalizations. The national security of the country was put at risk because so many people were working from home. And so let this be imagine your own family and your own interactions. This is Thanksgiving coming up next week, and this is exactly how it can be done, right? So now let us talk a little bit more about contact tracing and get some definitions out of the way. Contact tracing is the process of identification of persons who may have come in contact with an infected person and the subsequent collection of further information about these contacts, right? So it's about, if I get sick, who have I been in contact with? And what a contact tracer would do is contact people to find out what, are they sick? Tell them about your situation, and that they have to also now maybe isolate or quarantine themselves. The index case is the person who is who tests positive. Contact tracer is the person who is officially charged with contact tracing efforts. However, because the cases are now so much in America, you cannot contact trace this amount of people, which is why our program is extremely important, especially because people of color are being disproportionately affected by the virus. It's only us and our community contacts that can be sharing this information at the level. They would have to hire half of Massachusetts to be chasing down, cases that are growing exponentially, right? You just can't do it. There's no logistical method to be chasing down all the people, right? And the contacts are the people who have been exposed to the person during the infectious period. Remember, this is the most important part. We're trying to minimize exposure to the infectious period. When the person is not infectious, we're not worried. But once they get infectious, we want them to be away from everybody. If we can reduce that time of exposure to 0, we stop the disease dead in its tracks. Like I mentioned earlier, isolation is separating infected people from the general population. Quarantining is separating healthy people from infected people, or just basically telling, like, all the stay-at-home orders of healthy people. That is what they call quarantining. So this is another short video from Partners in Health. They're here in Boston.
What is contact tracing? Contact tracing is a vital way to stop the spread of deadly infectious diseases, from Ebola to COVID-19. Across Massachusetts, PIH is supporting patients and warning their contacts of exposure to the virus. Our model has since been replicated across other states. Here's how it works. When a patient tests positive, that person becomes the index case. A contact tracer calls this patient to learn who else may have been exposed. Then, the contact tracer calls the index case's contacts, family members, neighbors, colleagues, and virtually screens them for symptoms of the disease. If contacts show symptoms, they become suspected cases and are asked to quarantine. If they later test positive, their contacts will be called and the process repeats. If contacts don't show symptoms, they will still be monitored during the disease's incubation period. For COVID-19, that period is 14 days. This process will continue until all cases are identified, allowing us to track the virus, test, treat, and isolate patients, and stop the spread. But we need your help.
And that's actually what we need to start talking about. Like I said, to break these chains, especially in communities of color, we have to start thinking as African diaspora communities. We are not separate, we're all the same. We have to, and like I said, our number one job as contact tracers is to minimize the time a case spends with others, right? If we can if I know that I'm sick today, right? And I call somebody I was hanging out with yesterday, which I have not hung out with anybody yesterday, except for my cat. I heard cats can get coronavirus, but he's not hanging out with anybody either. But I could now tell them, hey man, I'm feeling sick. We were hanging out yesterday. I need you to quarantine. He will not be infectious yet, right? And if he now quarantines and gets infected and does not go on to meet anybody else, then that means that he will get sick and he will go through his infectious period without spreading it out, and therefore I've stopped the spread and saved lives. All right? We've talked a lot about these things before, and I said I would mention them over and over again. I thought about taking some of this stuff out, but I said no, that we need to drum it in 2 to 3 days before the onset of symptoms, right? And about 8 or 9 days after the onset of symptoms. This is the infectious period, all right? In that time, you need to be away from everybody. You need to stop, you need slowing, slowing or stopping transmissions means interruptions of these chains, right? Let's go into the video.
COVID-19 continues to spread around the globe. You can help stop COVID-19 by participating in contact tracing. How does contact tracing work? Contact tracing is a system that has been used for decades to stop infectious diseases. A contact is anyone who has had direct physical contact or was within 1 meter for at least 15 minutes with an infected person, even if that person does not have symptoms. This applies to anyone who has had contact from 2 days before a person gets sick until 14 days afterwards, or from the 14 days when an asymptomatic case tested positive. Once you are confirmed as a contact, you will be asked to go into quarantine, which means to separate yourself from others and to monitor your health for any signs of illness. The monitoring ends on the 14th day from your last contact with the person infected with COVID-19. Quarantine can take place in a special facility outside of your home or at home if you can stay separated from family members. Why 14 days of quarantine? It can take from 1 to 14 days from contact with the virus to develop symptoms. During this time, you should stay in quarantine and monitor symptoms and follow instructions given to you if you become symptomatic. Without contact tracing and quarantine, the virus will continue to spread. This leads to more people becoming sick and infecting the most vulnerable. By identifying and limiting contacts of people infected with COVID-19, the virus stops spreading and the community stays safe. To break the chains of transmission, we all need to work together. If you become sick with COVID-19, stay away from others. Follow the recommendations of your medical care provider and share the list of people who you came in close contact with. With your help, we can prevent further spread of the virus and save more people's lives. By acting together, we can break the chains of COVID-19 transmission.
Right. Now, one of the particular issues that we're facing as an African diaspora community is that we are not all from the same place. And even though we reside in the same quarters, we have different cultures, we have different religions, we have different languages, and we need to recognize what the African diaspora community is and know where we exist, because we actually need to work together. Because unfortunately, COVID-19 is not going after you because you're Ugandan or because you're Nigerian or Jamaican or African American. It doesn't care. But we all live together, mostly in cities, closely packed in tight quarters. We have jobs that expose us more to the disease. And so there are particular issues to do with African diaspora peoples and the people that live in our communities that we must pay attention to. African diaspora, as long as we are concerned, is defined as African American, Afro-Latin, Afro-Caribbean, and African immigrant. We do also recognize that we have so many members of our community that are not African descent. They may be Indian, they may be whites, they may be, from, Chinese, Asian, but they all live in our community and we will all get sick together. So we must work together. And so there's a video, and then after the video, we'll go into a little bit of peculiar things having to do with our African diaspora communities and how we need to use our cultural competency to save lives.
An African culture is a culture that enables Africans to survive. An African culture is a culture that enables Africans to see. An African culture is an African culture that enables Africans to grow. An African culture is one which enables Africans to develop. An African culture is enabling enabling African people to see themselves survive into the 22nd, 23rd, 24th, and 25th century ad infinitum. That is the African culture that I'm talking about. And it is devoid of cultural aspects except those cultural aspects that enable Africans to survive. Nothing is in it for the sake of simply being culture. For example, people will say, oh, I do this, it's my culture. I said, but why do you do it? Why do you put Mark here and here? Oh, it's our culture. Yeah, but why do you do it? You did this as a reflection during the time of continental African enslavement, so that if you marked your face here and here, if you went 1,000 miles, someone would know, oh, you're my brother because you marked your face here and here. We're part of the same people. That marking here and here has a particular reference to European, Asian, and Arab enslavement of African people. That's where that cultural tradition comes from. But you don't know why you do it. So you say, oh, it's my culture. That's not good enough for me. We need a culture where people are able to understand why they do what they do. The culture must be pragmatic. It's pragmatism based upon what enables Africans to survive, not cultural motifs that are about show. If it doesn't work to wear kinti, don't wear it. If it doesn't work to wear dashiki, don't wear it. If it doesn't work to wear agbada, don't wear it. We must understand the country in which we're living in. Because we're living in it. We must know and understand what is the nature of this country, because us understanding that will enable us to survive. If we do not understand the country in which we are in, then we will not survive. I put on my dashiki, I put on my kinti cloth. I'm all right. No, your kinti, your dashiki is not racism proof. It's not bulletproof. It's not prejudice proof. What it is a cultural motif, which you may choose or choose not to wear, but it doesn't mean that you understand. So in order to survive, you must know the place in which you're in. So therefore, people of African descent living in England, born in Britain, must understand the nature of the country in which they live in, and they must understand the history, politics, and identity of that nation. Without understanding that, we get lost. And wider than that, we must understand globally how things are.
Well, I thought that this video basically says it all. We are, like I said, we are at war. This with COVID-19. COVID-19 is attacking our communities more than others. It does not discriminate between whether you're from Africa, you're from the South America. It doesn't care. It doesn't care where you're from. So we must understand now our situation, and how we're going to survive it is by understanding, like the speaker said, we must understand the communities that we live in, and we must understand what we do for survival, right? So like I said, African descendant people are communal. We do act like villages and groups, and that is a very big thing and very important when you're talking about how we're going to survive this disease, because obviously we need to work together. Now, I don't see much problems with us working individually as ourselves, maybe as Nigerians, or working as Ugandans, working as Jamaicans, working as Haitian, working as African. I don't see, but I do see problems, especially when you're maybe talking about working as Latin Americans, because they speak a different language, right? The native indigenous Americans, the Taino tribes. I do see a problem with us working with each other, and we're all facing the same problems. So we need to understand some of our similarities. We're very God-fearing, religious, and spiritual people, no matter where you cut it, no matter how you cut it. This is an avenue for connection. It's an avenue that you can use to spread the word about COVID-19 and what needs to happen. We have a welcoming character. If you respect other people, people generally respect you. We respect our elders. These are benefits of the African diaspora community that can help us survive this ordeal, right? It takes a village to raise a child, which means that we do act like that. Everybody is in on it, right? Everybody's in on doing the right thing. How do we raise our children? How do, we are solving our problems together, right? Language is a bit of a barrier, but the culture, and by the time you take out the language and now you just look at African cultures, whether you're from South America, you're from Jamaica, you're from Africa, there are so many things. Once you break down when you go one little step deeper, you find out there are so many similarities that we're not really different at all. Just minor differences at the top that differentiate us, that make us unique and special, which is great. But finally, we need to understand that tribalism is our own racism. And keeping in groups is not for our survival here in America. And that is the overall thing. That cannot work. Back home, maybe it'll work, and it doesn't even work that well back home. Being tribal, I'm Haitian, I don't like Jamaican. Oh, I'm Nigerian, I don't like Ghanaian. Oh, I'm Ethiopian, I don't like, Eritrean. No matter where you're from, over here, we're all people of color, we're all African diaspora. The racism does not affect you differently. They don't go, okay, like somebody who's racist, maybe a racist white person, he comes to you, not going to ask you about where you're from, and he's going to treat you differently. To him, you're black, you're inferior. So we cannot now use tribalism when we get here. It must be something we absorb ourselves. And if we do that, we can maybe save some lives. We must understand America and its racist environment, and what issues historically, like redlining and Jim Crow laws. And have you ever wondered how all the black people happen to be separated from white people? It's because the white people made it that way. And they denied opportunities to people of color, which you may say doesn't affect you, but it does affect you, because who's a black person, an African-American or an Afro-Latino or somebody from Haitian would come to an African store and buy from you economically, come and eat your food. But if they don't have money because of the racism that's affected by them, how can they support you? So we have to understand this racial thing affects all people of color. And we all live in the same geographic locations in Boston. I live in Hyde Park, a lot of immigrants live here, Nigerian, Haitian. If you go up to Dorchester and Roxbury, you'll see more African Americans that live in the area. But we're all living in the same area. Mattapan, we're all living in the same group of area. So these areas get sick. We all have to stick together, and that was by design. So understanding the racist history that we live together because of this issue, because of what all saying, may help us survive. We have to understand that one of the things I don't like, and why my organization is very multicultural and everything we do does not promote one other over the other, is that there's a divide and conquer. Even in the nonprofit sector, when we're trying to get our money, they're always trying to give, we're going to give the African immigrants this amount of money. Then we're going to give the African this kind of money. We're going to give the Latino this kind of money. But I don't see them giving money for everybody to be joining and working together, right? Now, that doesn't mean that it is on purpose. Some of it is intrinsic, meaning that white people are doing it because they've been doing it for years and they don't realize that it's the negative effects that it's causing. But it is up to us, because it's our communities, to stand up, right? And finally, 2045 is the year where people of color will become more than the white people in this country. And that is having a lot of cultural effect on our communities at large. When you add all the people of color, plus what I call like the good white people, the people that are white that believe in equality and fairness for all, you'll find that we are now getting to already the majority. But it's causing a lot of cultural pressure on the side that don't believe in those ideals. And that is why we're having all this racial culture that we're having on today. So just to cut it short, we are being disproportionately affected by COVID-19. And fighting COVID-19 requires everyone in our communities, including our neighbors of non-African descent, to work together. Let us survive together. Okay, so as I've mentioned, some of the barriers, right, that we're facing, right, is that we do need to increase the knowledge, right? We are getting disproportionately affected. As you can see from this graph, we have African Americans, 74 out of 1,000 people are Black or African American. Next is Native American. Next is Latino American. Next is Asian American. Then we now have White American, and so basically almost everybody is having this has this issue, and that it is minority. And we're finding out that those that are been, and we can see here that those that have been systematically discriminated against, and this, remember, this goes to health, morbidity, child mortality, goes to security, everything. The more you are being affected by racism, it seems that you're going to have more underlying health conditions, and COVID will come and get you out. Now, we have to realize that some of the barriers, I've talked about some of them before, but when you talk about the misinformation, like what's going on with the vaccines are apparently very, very good that they're going to come out. But people don't trust the vaccines. Why don't they trust them? Because, well, Black people in this country were experimented on. Black women were sterilized without their knowledge as a control. White people were trying to control the population, so they were sterilizing Black women. These kind of things have us like, hey, don't worry, man, we're good. We don't want your medical facility. So that has been passed down to generation, right? I've talked about the redlining already, separating people, segregating people, not letting people live together. Then, of course, all the taxes that, your schools are funded by taxes. So if your area doesn't have a lot of educational opportunities because you've been denied opportunities to own housing and opportunities to loans, guess what? Your education system is not good, right? Then there's also issues to do with immigration. There's been a very big, it's not really even spoken of enough, that the treatment that the Mexicans have received from the hands of white people in regards to, if you go and do Google on Juarez, Texas, so many things, immigration, people coming over the border to work, it has been a very big problem. So of course, we immigrants may not want to be involved with the government in any way. And this is very evident in the census, right? They didn't want, when census people were going out, nobody wants to answer this strange phone number that's coming in on my phone that looks like a government number. We don't want them to know because maybe our immigration status is not up to date. But guess what? COVID-19 does not care whether you are a legal or a illegal immigrant. It will infect and kill you and your family just the same. So these are some of the barriers that we have to face in our communities, right? So we also have, of course, a lot of human and financial, don't have the resources. This program right now, we're funding it ourselves. We're looking for funding, but these are some of the issues. How do we break it down? How do we translate this information? In fact, right now, I want to ask if anybody wants to help us help translate some of this information that we have here. We would love for you to do it. If you want to have your communities give this very exact thing, we'll translate it into your language, and I'll provide our platform, and we'll invite people from your community, and we want to be part of that effort, right? Because we have to break down some of these language barriers and the cultural barriers. The public health officials, they cannot get to this level, obviously, because they have to break down, it's very difficult, right? Then, of course, there's the socioeconomic factors. If you tell somebody to contact trace and then you say, oh, look, I have COVID-19. If I tell my brother now says he can't go to work for 2 weeks, he's going to lose his job. I'm not trying to have that. So we're about to the last stage of this, this program. We're going to deal with like the practicality of actually doing the contact tracing, right? one of the things we have to do, we have to actually stay healthy. Okay. So this means that apart from washing your hands, wearing masks, socially distanced, contact tracing, we've got to go get our flu shot, because flu takes it kills a lot of people every year, and we don't have any space in the hospitals, like I said, right? Visit your virtual hospital, exercise. I walk every evening, even though it's getting cold. I'm like, look, I have to walk, right? Exercise, eat healthy. Use this as an opportunity to rediscover your faith or strengthen your religion, because that's also very healthy. Mental health and wellness. Look, stress relief. Sometimes, I'll watch some films because I'm COVID-19 all day, working all day. Just watch a film just to get your mind off everything, right? Stop bad habits. If you're, take this as a motivation. It is true. If you get COVID-19 and you're overweight, you are more likely to die. This is not about fat shaming. Forget the fat shaming. I'd rather you be ashamed of being fat. I'd rather you say I've hurt my feelings than you be dead. Simple. I have no apologies. This is not a war. I'm not going to be politically correct. Oh, well, I don't want to say that she's overweight. Use this as motivation, right? Stop smoking. Eat healthier, right? Another thing, connect with others. Very important. Call people. Make sure you call somebody maybe every evening. You've been in the house all day. You've been socially distancing. You're working from home. Call somebody up every day, somebody you have not talked to in a while. Just try to do stuff like that. We had a virtual birthday for my grandmother late last month. Let me tell you what, some of these virtual events are actually more personal than actually a meeting in person, because we were able to share and talk, and everybody was able to listen to each other. It was people from all over the globe. My grandmom lives in London. There were people from Nigeria, people in America, all over the place. And we were all sharing and having a Zoom birthday party for her. So make sure you do that. Then more importantly, and last but not least, we need to educate ourselves, enforce these things and all these things we're learning in our community, and develop an action plan, which means modeling. Don't just do as I say, do as I do, right? I like this little, I put this little picture up because obviously sometimes it just, we have to take a break. We have to eat well, relax, do some breathing and exercise. And like I said, connect with others. I can't tell you how that's enough. Let's not get, our mental health is also very important. All right. Now I want to talk a little bit about our action plan, right? It is not enough just to sit there and say, okay, well, I'm going to contact trace. What happens if you do get sick? What do you need to do, right? You need to, we need to, apart from being just aware and vigilant, but it's very important to be aware and vigilant. Once you become aware and vigilant, you start noticing, oh, that's not safe. This is not good, because it's in your head, which is what we're trying to do. Get it in your head that this COVID is always around, right? When you go to the grocery store, you'll be more careful. You'll be wiping your hands, you'll be washing your hands, you'll be making sure you keep, maybe you put hand sanitizer in your car, you put one in your house, you put one in the front of your house. All these little plans to make it a little more safe, right? Also research your options. If you get sick, where's the closest hospital? Where's the second closest hospital? Plan for the worst, hope for the best, right? If you do get sick, imagine the different scenarios. What about if your child gets sick then and you're not sick? What do you do? Right? And some of these are very difficult. What do you do for daycare? Oh, maybe you'll have to stop working. You have to start putting yourself in these things. If you need your essential supplies, okay, I get sick now. I'm not supposed to go to the grocery store. How am I going to go to the grocery store? Who am I going to call? How am I going to send them money to buy me the groceries? Get your cash app. Dude, there's so many scenarios. And these are the things that we need to get you mind on, because once you get sick, remember, I'm trying to minimize your exposure during your infectious period. So when you're infectious, how do you get your groceries? Keep stocked up on your medicine, right? Get your toilet roll if that's your thing. I remember when the thing started, everybody was chasing toilet roll. Hey, man, if things get rough, you got to wash your butt, man. You can't be, it's not about toilet roll, right? I'd rather you wash your butt than get sick and die. And I know that sounds very graphic, but guess what? That's where we are. This is not about being polite, okay? But also, like I said, you've got to develop a system around remembering your contacts. Whether it is, the easiest thing to do is keep a routine, right? If you do something the same every day, then when you do something out of the ordinary, it's easy for you to remember, right? So if you keep a safe thing, I don't go here, I go here, I don't do this, I don't do that. If you now see somebody, maybe go hang out with your friend one day, at least you know that that one person is a person I contact. Like me, in the last 3 weeks, my kids are not living with, there with their grandma right at the moment. So I've been alone really. I've only had like maybe 1 or 2 contacts in the last, like personal close contacts, 1 or 2 contacts in the last 2 or 3 weeks. And that's true. Everybody else has been virtual. Okay. So you have to understand it's extremely important. Forgetting somebody you had a contact with, right, could cost them their lives. And it's actually that serious. So I said prevention is better than cure. I didn't really bring the vaccine into this process until the end because I don't want us to get relaxed. Oh, there's vaccine coming. It's time to relax. Let's have Thanksgiving. No, there's no Thanksgiving. There's no Christmas. There's no New Year's Eve. In fact, even Easter. Forget about Easter right now. Forget about fun. We're at war. There are 2 vaccines coming out. Both of them are very effective. Both of them are promising to be very safe, right? We've got to fight the misinformation because if people don't take the vaccine, right now, I think they said 60% of the people will take the vaccine. Out of those 60%, 95% of them will be, 95% of them will be safe from the disease, which means we're only at 55. About 50, no, maybe even higher, 56, 57% of the people are promised to be inoculated. That's getting close to herd immunity, but it doesn't mean the deaths are not there. The new normal will be, just because we get the vaccine, we're still wearing masks till 2022, right? And also so it's going to be late spring before it's readily available to everybody. The first responders have to get it. The elderly have to get it. There's going to be, they need to vaccinate like 200 million people in the United States alone. We're not even going to talk about the right now about the cold storage and how cold that these vaccines have to be before you can use them. The Pfizer vaccine it has to be in dry ice, right? Negative 100 degrees Celsius, super cold. It's not easy to transport. It's not easy to use. That one is actually it's not even for third world countries, for Nigeria, where my parents are from, my mom, dad is from, it's not even possible. It's too expensive. But the Moderna vaccine actually is it's better. It has to be refrigerated, but it's like a normal refrigerator that can use it. Your CVS has a refrigerator that can keep things at that temperature. So that's the one that I think is going to be, is more available for the world, right? But it's now time to even be a little bit more extra vigilant. All right. Now, this is a very short video. I know that we're getting close to 2:30, and that was when we're supposed to end. But I really wanted, and this is the first pilot, so I know that maybe this has to be 2 sections, or maybe just one longer section. And I thank you for attending, thus far. But right now, this is not really COVID related, but the idea is just to give you ideas about tips on remembering, because it's all about coming up with a system to remember what it is that we are doing to keep yourselves knowing what you got to do to, who is there that you have to contact so that they don't get sick, right? There's social distancing. If you social distance naturally, like what I'm doing, every contact I have is a very big thing. In fact, the other day I did have to go to the doctor because they needed to take some blood and everything. And I was like, hey, you know what? This is like an outing for me. How you guys doing? It's exciting, right? Because I don't get to go out. So keeping us up in a bubble helps. There are technology and other tools which we'll get to, but we need to think about tips of remembering. Now, one of the things I did was I put together this contact tracing worksheet, right? This contact tracing worksheet it's a very elaborate one, but it's just to give you an idea. There are certain things that we have in our community, right, that we have to do every day. There's residential stuff. You have to go at home. You have to go to work. You have to either go to school. Somebody has to go to school. You have to get food and nutrition, and you have to take care of your health. And there are other things that you may have to do. Like I went to the mechanic once, which is, I have like some board meetings, and you try to put all these things in written form in front of you, and it may help you solve some issues, right? So like, I'll just take one day. So I did come in contact with my neighbor because he was coming down and he started talking to me. Now, I wasn't in front of him for a long time. It was a short discussion, but we did not wear masks because he's in our area, right? That it may be a mistake. That's something we have to watch out for, right? I did work from home. That's my occupational. I teach a class at Northeastern University, but of course it's virtual. So that was done by Zoom. I did go to the grocery store. Although it was a large area, I was in there for over 30 minutes, but I was trying to stay away from people. It wasn't them, but everybody was wearing masks, right? I did go to a Jamaican restaurant. I just went in for carry out. I stayed outside. I went and got my order, left, right? Went back in, got my food, left. Got home, my mom, oh my God, my mom wipes down all her groceries. I went to get my inspection sticker from the mechanic. I was very worried. I wound down the windows, so while they were working, nothing was going inside. Then when they got back in and got back out, I made sure I just sprayed I have a disinfectant in my car. These are the things you've got to do. For Thanksgiving next week, please, if you're serving, you can't have anything buffet. Anything that everybody will be touching, you can't have. If you're going to have drinks, everybody has to have their individual can of drinks. If you're going to have food, everybody's food has to be served out by the same person. You cannot have everybody going and, taking a scoop of macaroni and cheese, taking a scoop. No, you can't have that because everybody's using the same things. We just got to be smart about it. Okay. This is a little video about some of the technology that is around. Now, that it can help us. You can put reminders. You can, if you have Google Calendar, you can put all your things into Google Calendar. If you go anywhere, you can do it there. You can write it down. I've seen somebody actually put a little piece of paper or a whiteboard by their door. And when they come back in from going out, they write down the people that they've been in touch. And it may sound, oh, that's a little too much. People are dying. There are 250,000 people dying. It's a war. Do the extras just to make sure that you're safe. You don't want to have the responsibility of knowing that you spread it to somebody that ended up dying, right? Send information, share on social media, right? There's a lot of technology out there. I'm using my Zoom to do this webinar. This is some of the stuff we can do. We have a COVID-19 resource page, right? Go there. There are a lot of great resources for Boston, for international, for anything you need. I've tried to collect a good source of information about COVID-19. Also, I have a resource page, which I will share in the chat that has a lot of links to local stuff. And I'll share that in the meeting. I'm going to share this. There's some other web apps and contact tracing apps that you can get on your phone. And I'm just going to share this video so that you can kind of look into that and see what other countries are doing. It has something to do with privacy.
Let's turn now to our coverage of COVID-19. The federal government is asking Ontarians to help test out its national contact tracing app. COVID Alert is designed to warn Canadians if they've been in close contact with someone who's tested positive. And to talk about it, let's bring in Steve Niles, who's been looking at details for us so far. So, Steve, good morning to you. After some delays, people are finally getting a chance to test drive this app. So what's been the response so far?
More than 5,000 individuals now have this app on their phone. No reported bugs at this time, but it is just the first hours of the testing, the beta testing of this app. One app that many people are hoping could help identify those who have been exposed to COVID-19. The app is pretty simple in its design. It tracks where the device is being, and if it's been in close contact with any other devices that also have that app installed. And because our devices are always with us, it seems these days, that means people who have the app on their phone, that means that individuals have been close to each other as well. Should somebody test positive for COVID-19, they would voluntarily go into the app and say, yes, I have tested positive for COVID-19. That would then send a message to any of the other devices that had been in close contact with that device over the previous day saying, hey, you may have been exposed to COVID-19. So it's a pretty simple in how it works in its design. It is, of course, just the trial stages of the app for the time being. The next 2 to 4 days, people will be using the app. They'll be able to report any bugs, glitches that they have with it. And to really make sure that it's working, the app is actually going to be sending some false alerts to people just to see how this works. So a lot of hope being put into this app that it could help identify those who have been exposed. But of course, Michael, there are concerns.
Concerns, as you say, even though it's Ontario that's essentially beta testing, this is a national app. And many Canadians have expressed privacy concerns when it comes to an app like this. So talk to us about that one.
There are the concerns about that it could give away too much information. There are also concerns that it doesn't collect enough information. So more on that in a second. Let me explain. As for the concerns that it could be collecting too much information, Anne Kavukian, who's the former Information and Privacy Commissioner for the province of Ontario, she said she had been in multiple meetings with Apple, who had been working on this subject. She said that they did talk about privacy, and she said that because the app works via Bluetooth, no personal information is being swapped. Here's what she said.
Bluetooth beacons, they change every 15 minutes. So there's no ability for someone to say, oh, well, we located this person, we've got the identifier, we've got the keys, because they're constantly changing. They also called it exposure notification, not a contact tracing app, because they want to make it clear to people, you're not being traced or tracked or surveilled. What the purpose of this app is to enable you to be notified if you've been exposed to someone who is COVID-19 positive.
Now, there are concerns on the other side of this that I alluded to, that because it doesn't collect personal information, this app might not be effective. A lot of this information, this criticism coming from Niagara Region's acting chief medical officer is named Dr. Mustafa Hajiri. He said because the app won't tell public health officials who has tested positive, it can't start a good old-fashioned contact tracing stage that you would by contacting individuals humanly. Nor would public health be figuring out who has tested positive for COVID-19 because of this app. Hajiri says that in other countries, like they point to Singapore, South Korea, that they have very similar apps, but that one collects a lot of personal information. So he says that app is more effective. He has concerns that this one doesn't collect enough and therefore won't be effective. Michael?
Okay, Steve, thank you for that.
You're welcome.
So you can see that they are trying to do what they can. The time is now. And there's still a lot of issues that they have with some of these apps and things. But nonetheless, the idea is the same. We need to find out what we need to do. So if you do have infection and it is somehow serious, please call 911, right? Get in touch with an emergency contact, because now you need to go in and we need you to be taken in safely and get the treatment that you're looking for. If you have mild symptoms or you just want to find out, you can call 211, and their busy times are weekdays between 3 and 6. So if you're not, you can call around those times. Find out from your local health officials where to go and get tested. You can go to this. I have some links in our resource page where you can go to the city of Boston, find out where the testing sites are, or mass.gov, find out where the testing sites are at. Schedule ahead and get your test. Find out. If you feel like you have symptoms, you want to be careful, please just inform people like Shireen did. Inform people, call your doctor, and then, go get your test, right? Find out what's, your situation. My hospital, there was an email I got where my hospital, Brigham and Women, sent me, they've sent me a COVID test. So I'm about to take the COVID test and send it back to them. because they want to see how maybe we can get people to get tested in their homes. Very good idea. So there's so many things around this, but all in all, this program is there for us to start, hope it was very holistic. I hope you enjoyed it. I hope it caused a lot of information. Sarah, I really appreciate you joining us. And Rory, thank you for joining us. I sent out some poll questions. Please fill out the poll so we can answer them. If you have any questions, please let me know. I would like to hear your feedback. This is the first one. Obviously, I think it needs to be a couple of hours long, because from now would be where we would get a lot of feedback, community feedback. It's not supposed to be one way. But yeah, I definitely want to hear from, I am allowing any of you to talk if you would like to talk and kind of share what you have to say. And then have you guys filled out the polls? Let me see. Okay. Attendees are now viewing. Okay, only one of you have voted. Has anybody else? Rory, I think you probably want to vote. Have you voted? Okay. I'm at work with COVID testing center and management, and we'll be happy to collaborate. I'll follow up with an email. Thank you so much. Thank you so much, Sarah. I really appreciate it. I really do. Okay, let me do the polling so we see what everybody said. Okay. Well, which of the following is not an option to Yep. None of the above is correct. The most important time for period for contact tracing is incubation period between 2 and 4 days. Yes. I wanted to see, I think for the contact tracing, I would say that I'm really looking for the 2 to 3 days prior to onset of symptoms, because of the, but they're both great answers. Some of these are not right or wrong. It's just, wanted to see where everybody's mind was at. Then, which are the following are modes of transmission? Okay, yep. Waterborne is not one of them. Fantastic. Dash is separating infected people from general population. Quarantining. Actually, no, that's not right. It's actually isolation. Quarantining is separating healthy people from the general population. Our job is dash to minimize the time of case spans with others during infectious period. Yep. Contact tracers. African diaspora are better suited to combat COVID-19 because of cultural connection of our multicultural community. Which of the following below are negative influence to community and unity? Yep, tribalism. Which of the following are not part of the COVID-19 basic public health directives? Congregate with 10 group. Yep, that is true. Everything else, you're supposed to wash hand, wear a mask, socially distance, contact trace. Congregate with groups of 10 is not basic public health directives. Maintaining all-round health and wellness during COVID-19 is very important and includes, yep, every single one. That was a trick question to see if anybody would think that they didn't have. Every single one of these is important. Religions and spirituality, exercise and mental health activities, virtually connecting with others, get a flu shot, make a COVID-19 action plan. Remembering your contacts of 2 to 3 days prior to the onset of symptoms is very important. Tips to remembering your contacts does not include going to a party. Exactly. And okay, let me so telling. Oh, let me share the results. Okay, so I've shared the results. So I'm very happy with this program. Like I said, I want to translate it. I want to get it out to different communities. And I also need people that can speak other languages. So if you have any connections and if you want to participate and support this program, we're also looking, of course, for funding so we can advertise. This program is designed for the leaders of different communities, because obviously there'll be people that maybe they're working, they don't have the ability to get online. and things like that, or maybe they can't understand, they don't speak the language and things like that. These are the barriers that we're interested in hosting. So, like I said, anything else? Yeah. So yeah, Sarah, is there anything you would like to say? Because I really do. With you say you work with a COVID testing center. I do believe that this kind of program would go a long way along with a testing program.
I unmuted myself. I can speak.
Excellent.
All right, but no camera today.
Thank you so much. Thank you so much for attending.
Yeah, so I'm an infectious disease scientist by training anyway. So we have, I'm part of this Mass General Brigham COVID Innovation Center. And there's a diagnostic pillar as part of the program. And as part of it, I run a lab for evaluating new technologies for COVID testing, but we also work with an implementation working group that actually looks directly at how best to implement COVID diagnosis in different diverse communities.
Mm-hmm.
And one of the co-chairs, Dr. Cheryl Clark, actually has been leading a lot of the mobile testing in communities that have a lot of members of the African diaspora, Roxbury, Matapan, etc. So she's really invested in doing this type of work. So aside from that, we actually have connections with the Department of Public Health, and they've been receiving a lot of rapid antigen tests, as you guys probably know. These tests are in theory, they're really great for contact tracing because you get your results within 15 minutes. But the FDA approved them very quickly without actually getting systematic data from people who don't show symptoms, which are about half the people who are infected. So we're trying to evaluate those in people who just go into mobile testing because they thought they were exposed to someone who had COVID. And just partnering with different community mobile testing units or boards of health. We're actually planning one in Holyoke, Massachusetts. So just to make the long story short, we're actively trying to engage communities, but with an eye for making sure that the tests are accurate first.
Okay.
And if there is an interest in participating to accelerate that work, I think it's a benefit both ways because the idea is not to just evaluate for the sake of evaluation, but to actually implement those tests in underserved communities.
Can you see this? I got this. This is what I got from Test Boston. Are you?
Yes.
Yeah.
So I don't work directly with Test Boston, but I know the person who runs it. So
Okay.
she's the other co-chair actually of the implementation working group. Her name is Deb Hung. You probably saw that in the letter.
Yeah, so I'm going to take this test. This is my first COVID test. I have just been isolated. So, it's very interesting. But what I'm finding is that, in our communities, especially African diaspora communities, it's very difficult to break past the upper level, so to speak, right? And so what efforts are you finding, or what issues are you finding in that regard, like getting to our, communities, just the normal average everyday guys who are going to work? How do you think is good to break down? How do you think this program works to trying to break down those barriers?
Yeah, so there's two levels, right? There's a structural level, like you said, systemic racism, access to diagnostics, funding, and there's just a lot of competition for COVID tests right now, and big companies and big universities are buying a lot of the supply chain, so it's becoming less available for community surveillance. But then there's also the other part which you spoke about, which is just distrust from the African-American community, not just African-American, the African diaspora community in general towards healthcare providers. And sometimes, and I heard this in my social circles as well, people just don't want to know.
Ignorance is bliss.
Yeah. I think there's work, and one of the main problems, of course, I mean, you're trying to say this is not a political issue, but it's definitely a political issue because we don't have consistent messaging from federal bodies. So then it's really up to the individual to decide whether or not to believe things. And usually when there's an epidemic and you want to encourage people to take vaccines, to take testing, there's accompanying funding for those programs to raise awareness about the benefits of these things, which hasn't happened actually since the beginning of the pandemic.
Yeah.
The resistance, there is community resistance and there are structural issues, and we're trying to bridge the gap between the two. I'm just starting to get involved in the community aspect. I'm mostly in the lab. Yeah, the issues you highlighted are spot on. You know, people don't want to know.
We really appreciate that, because that is exactly the vacuum we're trying to fill in, is the one that there is no awareness. Like, it's just like there is no consistent message. And
yeah.
I guess what I was trying to say is not that it's not political. It is political. They made this very simple thing a political statement.
Yep.
This means I'm a Democrat, you know.
Well, it's not blue.
You know, and it's not a political issue, but they've made it into a political issue.
Yeah, that's correct.
And I feel like the messaging needs to be just as strong. That's why we're trying to use, this is not what, you know, you followed us for a while. This is not what we typically do, but it came, we felt that we had an opportunity to make a big difference because of, we do deal with cultural competency. So how, if we join that with public health, maybe we'll be able to fill in that gap and try to send out consistent messaging. So if you even notice, the actual part, and I had to wrestle with it, because, you know, when you're putting the slides together, you're trying to ensure that you're giving a lot of knowledge about the science. But I started thinking, well, the science is there and we put enough in there, but it's really to fight against the misinformation. That's like the biggest.
Yeah, absolutely. Yeah.
You know, that's the biggest problem that we're having. Our communities, you know, they're socially, economically challenged, so they're working odd hours. They're tired. How do we break through? So we're thinking about, taking these kind of programs to schools, because, at least the city has already provided them. Has already provided them computers and, try to work on their connectivity because of the school. And if we can go through schools, maybe we'll get to their parents, and, so it's really complicated, but it really, the lack of support, the lack of consistent messaging. I mean, this is just the worst. It's the worst situation to find ourselves, to have this kind of poor leadership.
No, I absolutely agree.
So I can talk.
So unfortunately, we need the leadership in our community. So I really appreciate the work you're doing and
thank you. Thank you. Well, I hope to get your contacts. I mean, I know we've been connected a little bit, like through social media, but yeah, I would love to get more connected to the to the inside of people actually, and if they see the program. Like I said, we're 501c3, so we're hoping to, raise, at least tax, give our tax exemption as a way of raising money. But we do need to get this thing going, and it needs to go now. So I'll be in contact, and
yeah, and I would love for you to come and actually speak to our working groups. I think that.
Please, let's schedule a time. Schedule a time. No issues.
All right.
I actually have another webinar that's happening in 15 minutes. I'm giving a webinar on how to give webinars because it's part of this program in a way, because obviously if I have people that are going to now be giving this webinar, where are you from? If you don't, I think where are you from? Let me not guess.
I'm mixed Sudan, Ethiopia.
Okay, Sudan, Ethiopian. Okay. So obviously your own ethnic communities, we'll need somebody that can maybe speak in the language, and so there needs to be some sort of a little bit of overall training on that. So that's kind of why they're together. Yeah, I want to go get something to eat in the 15 minutes before that one starts.
No problem. Okay, I'll send you an email.
Please do, please do. And I really appreciate it. Is that Rory? Rory, have you tried contacting some sports, local, national celebrities, collaborate? I came in late. Can we talk? Of course, we can talk later. I have not reached out to any celebrities in sports yet, but this is the inaugural one. I wanted to get a feel of what people would think, just attending, and then and also, like, I realized it has to be a 2-hour. It has to be a 2-hour thing because obviously people need to talk, and I could shorten up some areas. So yeah, I just want, this is a pilot, and definitely we're going to do more. So if you have any spots, I don't know, I'm not a big person. If you have any celebrities, please send them my way. It would be helpful, so thank you for that question, Rory. All right. Well, thank you, everybody. I really appreciate it. Thank you so much, Sarah. Thank you so much, Rory. I'll be doing another one hopefully very soon. And we'll go from there. Thank you. Have a great day. Remember, stay safe. Wear a mask. These things right here. Wear a mask. Socially distance. Wash your hands. Don't go into any spaces that are enclosed. And remember, contact trace. Remember where you've been the last 2 days. Thank you very much, and have a great rest of your day.